Hello everyone, and welcome back to Secure Your Benefits. It's May 26, 2025, and today we're covering some very important updates to Medicare and how these changes are directly affecting Social Security recipients across the country. Whether you're already receiving benefits or you're planning ahead, the changes this year are significant, and it's crucial to stay informed so you can protect your health and your income. To begin with, Medicare Part B premiums have seen an increase in 2025. The new standard premium amount has gone up to $185 per month. This is an increase of over $10 from last year. Alongside this, the annual deductible for Part B has also risen and now stands at $257. These changes may not seem massive at first glance, but when you consider that many Social Security recipients are living on fixed incomes, even modest increases like these can have a meaningful impact on monthly budgets. One of the biggest concerns for those living on Social Security is how much of their monthly benefit gets eaten up by Medicare premiums. Remember, Medicare Part B premiums are typically deducted directly from Social Security checks. So if you're receiving Social Security and you're enrolled in Medicare Part B, you're likely already noticing this new deduction. While there was a cost of living adjustment for Social Security benefits this year, a 2.5% increase rising Medicare costs may offset those gains for many retirees. For individuals with higher incomes, the financial impact can be even greater. If your income exceeds certain thresholds, you are subject to what's known as an Income-Related Monthly Adjustment Amount, or IRMAA. This applies to both Medicare Part B and Part D. For 2025, individuals earning more than $106,000 and couples earning more than $212,000 are facing increased monthly premiums, sometimes significantly higher depending on how far above the threshold their income falls. These income brackets are calculated based on tax returns from 2 years prior, so your 2023 income determines your 2025 IRMAA adjustment. There is, however, some good news when it comes to prescription drug coverage under Medicare Part D. Thanks to new provisions rolling out this year, there's now a cap on annual out-of-pocket costs for prescription drugs. That cap is set at $2,000. Once you've reached that spending limit on your prescriptions, your plan covers the rest. This change is particularly important for people who take high-cost medications regularly. In previous years, the so-called donut hole in Medicare Part D coverage meant you could face substantial costs even after your initial coverage phase ended. That coverage gap has now effectively been closed, and expenses are much more predictable. To help beneficiaries manage their drug costs even better, a new monthly payment option has been introduced. You now have the ability to opt into a Medicare prescription payment plan that spreads your out-of-pocket prescription costs across 12 monthly installments. This can make budgeting easier, especially for those who are managing complex conditions that require expensive medications. Another positive development is the insulin price cap, which remains in effect for 2025. For anyone who needs insulin, Medicare now limits the cost to just $35 per month. This applies across both Medicare Part B and Part D, depending on how the insulin is administered. This is a major win for people living with diabetes, as it significantly reduces the financial burden of a life-saving medication. However, while these enhancements in drug cost coverage are encouraging, there are some looming policy developments that could impact Medicare and Social Security in the years to come. One of the most talked about pieces of legislation recently passed is a sweeping federal tax and spending package often referred to as the One Big Beautiful Bill Act. This bill is expected to significantly increase the national deficit over the next decade, and that has raised concerns about automatic spending cuts under federal budget rules. If Congress doesn't act to offset the bill's cost, the law could trigger automatic cuts to Medicare funding in future years, potentially as much as $500 billion between now and 2034. While these cuts wouldn't affect current benefits immediately, they could result in reduced services, lower provider payments, and possible limitations on access to care down the line. This has understandably made a lot of Social Security and Medicare recipients nervous, especially those who rely heavily on these programs for day-to-day survival. Another part of that legislation introduces new restrictions for Medicaid, including work requirements for able-bodied adults aged 19 to 64. There's also a cap on home equity eligibility for Medicaid long-term care services, now set at $1 million without annual inflation adjustments. These changes don't directly affect Medicare, but they are part of a broader shift in how federal support programs are being shaped moving forward. And they could influence future changes to Medicare policy as well. Now let's talk more specifically about Social Security. As mentioned earlier, the 2.5% cost of living adjustment for 2025 has pushed the average monthly benefit for retirees to about $1,976. That's up from around $1,927 in 2024. While the increase is designed to help retirees keep pace with inflation, it may not go as far as many had hoped, particularly when higher Medicare premiums and general cost increases are taken into account. For those still in the workforce who are receiving Social Security benefits before reaching full retirement age, the earnings limit has increased. In 2025, you can earn up to $23,400 before any of your Social Security benefits are withheld. If you earn more than that, Social Security deducts $1 for every $2 you earn above the limit. Once you reach full retirement age, those limits disappear entirely, and you can earn as much as you want without affecting your benefit payments. Full retirement age itself continues its slow rise. For people born in 1959, full retirement age is now 66 years and 10 months. For anyone born in 1960 or later, it will be 67. Remember, delaying your Social Security claim past full retirement age still earns you delayed retirement credits, which can increase your monthly benefit by as much as 8% per year up until age 70. So if you're in good health and can afford to wait, it may be worth considering. Another important update for those interacting with Social Security offices is a shift to appointment-based service. Starting earlier this year, most Social Security offices now require appointments for any in-person service. Walk-ins are only allowed for individuals in urgent situations, such as those experiencing homelessness, veterans, or members of the military. If you need to apply for benefits, replace a Social Security card, or handle any other issue, be sure to schedule your appointment in advance. This change is designed to improve wait times and customer service, but it also requires a bit more planning from your end. In addition, the taxable maximum for Social Security payroll taxes has increased this year. In 2025, the cap has been raised to $176,100. This means higher earners will contribute more towards Social Security, which helps to support the solvency of the program. Whether these increased revenues will be enough to offset long-term funding issues remains a point of debate in Washington, but every extra dollar helps maintain the strength of the program. Looking ahead, there is also growing discussion about the future of both Medicare and Social Security, particularly as more baby boomers retire and strain on the system increases. Lawmakers are under pressure to come up with long-term funding solutions, and that could mean potential changes to eligibility ages, benefit formulas, or payroll tax rates in the years to come. Nothing is set in stone yet, but we encourage everyone to stay tuned to developments, and here at Secure Your Benefits, we'll be sure to keep you updated every step of the way. So, to wrap things up, while there are definitely some positive changes this year in terms of drug cost caps and benefit adjustments, there are also some growing concerns about how long these programs can sustain current benefit levels. As always, it's important to plan ahead, understand your rights, and stay informed. Medicare and Social Security are lifelines for millions of Americans, and staying on top of updates like these helps you make the most of your benefits. Thanks again for watching Secure Your Benefits. If you found this information helpful, please hit the like button, subscribe to the channel, and turn on notifications so you never miss an important update. Share this video with friends or family who may be affected by these changes. Take care, and we'll see you in the next video.